to pay for the service or not.
And Dr. Helena, what is the CyberKnife commonly used in the treatment of? And even as you walk us through the CyberKnife, let's also talk about the Comprehensive Breast Cancer Center here, where you get rapid results in only a matter of days. But let's begin with the CyberKnife and what it is routinely used in the treatment of.
So the CyberKnife is a radiotherapy machine. However, it is non-invasive and it's able to deliver treatment through a robotic arm. So the linear accelerator is mounted on the robotic arm. We're also able to take imaging whilst you get the treatment to ensure that the treatment delivery is actually precise for the cancer that we're treating. We can treat different types of cancer with this machine. Anything from the brain to the spine, to the lungs, to the prostate, to the kidney, to the pancreas. So different types of malignancies can be treated with the CyberKnife, and we hope that it will be a non-invasive way to manage tumors that cannot be operated on.
And questions around whether it reduces the number of sessions that the patient would require as opposed to the other treatment options and side effects as well.
So in terms of the delivery of treatment, we're able to deliver the treatment between 1 to 5 fractions, which is 1 to 5 sessions. Unlike with the conventional linear accelerator, where we treat anything from 15 to 38 or 39 sessions. So with the CyberKnife, we can deliver treatment, a full course of treatment within a week and be done with that treatment. In terms of reducing side effects, it's on the tumor location. So it spares the normal that are not affected by the tumor, ensuring the side effects are limited as compared to other forms of radiotherapy.
And Dr. Kiflom Sayom, in terms of testing and diagnosis, are there simple blood tests that can be done if somebody wants to check whether or not they may have any cancer cells in their body? And in terms of the Integrated Molecular Center, what have we seen in terms of the impact it has had on the populace as regards affordability of treatment as well as access to treatment?
Thank you very much for that question. So I'm a nuclear medicine physician, and to correlate your question about the blood tests for cancer screening, so normally nuclear medicine is specialties, but it's literally a brand new specialty, especially in Africa. So it's all